Hey, this is Nick responding to Amber. Amber, you had a lot of good things to say in your post. Totally agree with you about the patients pitching a fit and then getting what they want is a major factor. I think it relates to the patient satisfaction scores that some of the doctors receive, and they want the patients to be happy, and if they want an antibiotic, they get an antibiotic. So yeah, I totally agree with you there that that just needs to stop. Um, and then I also liked what you said about education. That's like a big factor as well. And so, and I was reading on some things and came across an article that just had some reasons why patients are non-compliant and what the we as nurses can do to help them be more compliant. And it just gave some, it went through a whole list of things, but some things that stuck out for me was the factors for age, increase in the elderly, obviously due to a mental status uh, and their education level, increase in adolescence due to them being rebellious or just, saying I'm not taking it, and increasing young adults just because they have busy with life and careers and work and have other things on their mind besides taking their antibiotic when they're supposed to. Um, and some other things that came about with just the treatment was the complexity of dosages. I know when we prescribe some medications over a 10-day course, they got to take it twice, sometimes three times a day, and so that can be a little cumbersome to their, I guess, their lifestyle. Obviously, that some education needs to go in there, especially if they have a complex dose. And the article talked about that, explaining why they needed to they needed to take this, what the purpose of it was, and that kind of thing. Um, so yeah, they went on for a bunch of other things. The side effects that some of the medicines can give, and obviously with antibiotics, the yeast infection, diarrhea, vomiting, nausea, um, and the patient's health literacy. Um, how knowledgeable they are about healthcare in general. Interesting one was smoking. Those who smoke were more non-compliant, and at the end, the main things that they stressed were increased education and increased communication. So yeah, it was a good article, and just went over a bunch of things why people are non-compliant. So I think being knowledgeable about that can help us to educate our patients about being more compliant. Appreciate the post. Thanks.